Hello everyone. Today we will discuss about a very important topics for both medicine, surgery and Ghanaian ops, which is shock. So let's start. First of all, what is shock? Shock is when your body is hypoperfused. All systems of your body are hypoperfused due to any cause is defined as shock. So if we see the definition of shock, it is a systemic state of low tissue perfusion that is inadequate for normal cellular respiration. With insufficient delivery of oxygen and glucose, cells switch from aerobic to anaerobic metabolism. If perfusion is not restored in a timely fashion, cell death ensues. So, during shock, what happened at cellular level? Mm, How cell responds to shock? So, cells are deprived of in shock. How we discussed earlier, cells are deprived of oxygen and must switch from aerobic to anaerobic metabolism. Then, accumulation of lactic acid in the blood due to anaerobic glycolysis. Then, metabolic acidosis, and also glucose within cells is exhausted. Anaerobic respiration ceases and there is failure of sodium potassium pump, which is vital for cell. Then the lysosomes release autodigestive enzymes and cell lysis occurs. As a result of cell lysis, intracellular content including potassium are released into the bloodstream and there is hyperkalemia. Then what happened in microvasculature during shock? First of all, activation of immune and coagulation systems. Then hypoxia and acidosis activate complement and prime leukocytes. Then generation of oxygen free radicals and cytokine release and injury. As a result of these events, there is injury of capillary endothelial cells, and as a result of this injury, tissue edema and exacerbating, and these all events exacerbate cellular hypoxia as due to injury to capillary endothelial cells, fluid are leaked through into extravascular space, and there is further hypovolemia, further hypoxia, and tissue edema, which exacerbate cellular hypoxia. And ischemic cell death release potassium into the circulation, leading to systemic hyperkalemia and acidosis, as well as further damage to molecules that systematically activate the immune system. So, how the cardiovascular system responds to shock? Prelude and afterload decrease compensatory baroreceptor response, resulting in increased sympathetic activity and release of catecholamines into the circulation, and the tachycardia and systemic vasoconstriction, except in sepsis or septic shock. We also discuss the septic shock in our later. So how the respiratory system responds to shock? Metabolic acidosis and increased sympathetic response, then increased respiratory rate and minute ventilation, then increase the excretion of carbon dioxide and so produce a compensatory respiratory alkalosis. So what happened in kidney? Decreased perfusion pressure in the kidney as due to hypovolemia or hemorrhage due to volume loss. So decreased perfusion pressure in kidney, then reduced filtration at the glomerulus, and decreased urine output. And as a result of this, renin-angiotensin aldosterone axis is stimulated, resulting in further vasoconstriction and increased sodium and water reabsorption by the kidney. So, how body's hormonal response occurs to a shock? Activation of adrenal and renin-angiotensin system. Vasopressin, antidiuretic hormone, is released in response to decreased fluid and result in vasoconstriction and resorption of water in the renal collecting system. And cortisol is also released from the adrenal cortex, contributing to the sodium and water resorption and sensitizing cells to catecholamines. Then we discuss about the types of shock. Hemorrhagic or hypovolemic shock, cardiogenic shock, obstructive shock, distributive shock, and endocrine shock. Then we discuss about elaborately about the types of shock. So first, hemorrhagic or hypovolemic shock. From the name, we can assume that this shock is due to hypovolemia, which is maybe due to any cause. So, hypovolemic shock is due to reduced circulating volume. It may be due to hemorrhage or non-hemorrhagic cause. What are the non-hemorrhagic cause? Such as poor food intake, dehydration, excessive fluid loss due to vomiting, diarrhea, urinary loss, such as diabetes, evaporation, or third spacing. In third spacing, fluid lost into the gastrointestinal tract or interstitial space, as for example in bile obstruction and pancreatitis. And in third spacing, fluid is inside the body, but body cannot use it, and the fluid is useless. So, what is cardiogenic shock? It is primarily due to failure of the heart to pump blood to tissues. The cause of cardiac shocks are myocardial infarction, cardiac dysrhythmia, valvular heart disease, blunt myocardial injury, and cardiomyopathy. So, what is obstructive shock? In obstructive shock, there is a reduction in preload due to mechanical obstruction of cardiac feeding. Common causes of obstructive shock include cardiac tamponade, tension pneumothorax, massive pulmonary embolus, or air embolus. Then distributive shock. Distributive shock describe a pattern of cardiovascular response characterized by a variety of conditions include septic shock, anaphylaxis, and spinal cord injury. All are collectively called distributive shock. Inadequate organ perfusion is accompanied by vascular dilatation with hypotension, low systemic vascular resistance, inadequate afterload, and a resulting abnormality high cardiac output. So, in anaphylaxis, vasodilation occurs due to histamine release. In spinal cord injury, there is failure of sympathetic outflow, inadequate vascular tone. We know sympathetic supply of vessel maintain a sustained contracted state, and if the supply is cut off, then the vasodilation occurs and vascular tone is abolished. In sepsis, release of bacterial product is endotoxin and the activation of cellular and humoral component of the immune system. There is maldistribution of blood flow at microvascular level with arteriovenous shunting and dysfunction of cellular utilization of oxygen. Then endocrine shock may present as a combination of hypovolemic, cardiogenic, and distributive shock. Cause of endocrine shock include hyperthyroidism and adrenal insufficiency. Hypothyroidism causes shock state similar to that of neurogenic shock due to disordered vascular and cardiac responsiveness to circulating catecholamines. Cardiac output fall as a result of low inotropy and bradycardia. There may also be an associated cardiomyopathy. Thyrotoxicosis may cause a high output cardiac failure. The adrenaline insufficiency leads to shock due to hypovolemia and a poor response to circulating and exogenous catecholamine. Adrenaline insufficiency may be due to pre-existing Addison's disease or may be relative insufficiency due to a pathological disease state such as systemic sepsis. Thank you all.